All right, the Health Subcommittee, Education and Health will come to order. I guess we need to take attendance.
Senator Saslaw, Senator Barker,
Here.
Senator Dunavant,
Here.
Senator Suderline, Senator Lewis.
Here.
Mr. Chair, we have a quorum.
Great. All right, we've got a sign-up sheet up here, and the first one up here is Senator Sorrell.
Mr. Chairman, I have a substitute.
Yep. All right. Let's move the substitute.
Moved and or
Second.
Seconded.
Second.
Aye. Substitute's in front of us.
Thank you. Thank you, Mr. Chairman. So you all heard this bill a week ago. I had the pleasure of Zooming with a whole bunch of people on Sunday afternoon. And by which we arrived at a compromise, which I believe, having done that, there's peace in the valley and everything. But if you really want to get into the details, the meat of it is on lines 88, 89, and 90, and then lines 184 and 185. But Mr. Johnson also took this having the statute in front of us as an opportunity to link up the definition of healthcare record with what's in the HIPAA statute, so that this 801 section was a little more consistent with the code and clear. So that's why it got a little bigger and there's more strikes in it and stuff.
Any questions? We heard this, sort of kind of heard this.
Yeah.
just need peace in the
Sort of kind of heard this last week, and I think we suggested that you all get your heads together, as you said, and you Zoomed on Sunday, and this is the result. So,
Yeah.
Are there any questions of Senator Sorrell on 350 from the panel? Senator Barker, do you have a question?
Which was the second of the two sections, lines? You said it was lines 88 through 90, and there was one other section, I think.
184, 85.
All right.
Okay. Is there anybody here, and I think we said we weren't going to take a whole lot of testimony on 350, but just to let people have a chance to vent, is there anybody on 350, Scott?
Yes, sir, Mr. Chairman. I'd just like to thank Senator Sorrell. We did have a Zoom on Sunday with Brent and Julie from the Hospital Association and Mark Dixon, my trial lawyer, and Senator Sorrell, and we addressed the HIPAA concerns that I raised the last time, and we addressed the cost concerns, because an audit trail is not free, and we make sure that you can be reimbursed for it. And we also clarified that not every request by a patient or lawyer is going to get an audit trail. You've got to specifically request it. So I think we've got hopefully peace in the valley. And like he said, we used it as an opportunity to modernize 8.01413, which was out of date by years.
Okay, good. All right, any questions after Scott? Anybody opposed to 350? Anybody with a problem with this compromised piece of legislation that was hashed out over long hours over the weekend?
Move to report.
All right, it's been moved and seconded that we recommend reporting the amendment in the nature of substitute for Senate Bill 350. Call the roll.
Senator Barker,
Aye.
Senator Dunavant,
Aye.
Senator Lewis.
Aye.
Ayes 3, noes 0.
There you go.
Thank you, Mr. Chairman.
Yep. All right, we have a couple of people on the sign-up sheet who have the, oh no, I started to say I had the misfortune of not being here, but I see Senator Hanger. Senator Hanger, you're next.
Okay. Thank you, Mr. Chairman, members of the committee. I have Senate Bill 650.
All right, sir.
I expect, I don't know whether Senator Deeds is trying to address the same issue or not. There may be a couple more people trying to address it. If it's something that he's working on too, we might want to get our heads together on it. But we've had a continuing problem with the custody and transfer of individuals that are subjects of emergency custody orders leading up to temporary detention order. And so to try to get something in the hopper, I had a bill drafted that would basically require the hospitals and emergency room departments to provide security staff, and then we would put some money in the budget to cover their costs. Well, in the process of trying to work out something, I've come up with some language in a bill that's completely different than that, but it addresses the subject, and that's where I don't know, there may be other bills that are like this, but I'm kind of pleased with this one, the way Ms. Stanton drew it up here. And I do have an amendment in the nature of a substitute. She's helped me out a lot. For a long, long time, she's helped me out.
Kept
Come
you
up
out of
with these
trouble.
great
Yes, she
ideas.
has.
Kept you out of trouble.
She's an amazing help, right?
All right, so let's.
All right, so the issue, of course, is, we're tying up too much local law enforcement. We just don't have a good system. And we've already invested we initially had pilot program, and then we contracted for transportation services on a piece of what we're doing with these individuals. And Senator Barker, of course, has worked on this a lot as well, as other people have. But what this does, do we have this available to everybody?
Yeah, we've got it. Oh, I thought, what do we have here?
Got a hard copy?
They have a hard time.
They got, oh, good,
Yeah,
good,
yeah,
good,
okay.
good, okay.
And
So,
let's get the substitute in front of us. Somebody want to move the substitute?
Second.
Moved and seconded, we adopt substitute. All in favor say aye. Aye. Substitute's in front of us. Go ahead.
okay, so I would begin by just flipping through. On page 2, you have a minor tweak there where we add the people who may qualify to provide custody and transportation in this situation to, it could be, in addition to the ones already in code, an employee or person providing services pursuant to a contract with the
Who do
department.
you envision that to be? I mean, who would do
A
that?
contractor. We have contractors now. We already have a contractor.
The
and we could-
transport
And we could hire a transport company.
I didn't realize that.
They have,
Okay.
they have specialized vehicles, and they do a good job.
Okay.
We had a pilot program down in Southwest Virginia initially, and then we expanded it statewide.
Mount Rogers.
Mount Rogers Community Service Board, right?
Okay.
Okay, so that's the language tweak there. Then on page 3, you get to, the substantive part of the bill where it says the primary law enforcement agency may transfer custody of the person to the alternative transportation provider immediately upon execution of the emergency custody order. And so you can read the language there. And then if you go on through, we readdress that in the temporary detention process where we have similar language on page 7. And then at the end of the bill on page 9, you'll see the enactment clause there, which then I think makes this work. It gives, it says the Department of Behavioral Health and Developmental Services shall amend its existing contract for the provision of alternative transportation of a person who is subject to emergency or a TDO and enter into new contracts for alternative transportation of these individuals, as so on and so forth there. So that's
Okay.
the bill, Mr. Chairman, and I think as drafted with my capable staff person here that helps us all, it could lead to something very positive.
Good. All right, so we have Senate Bill 650, amendment of in the nature of a substitute in front of us. Are there any questions from the subcommittee for Senator Hanger? No. All right. Anybody in the audience want to speak in favor of Senate Bill 650? Anybody want to speak against Senate Bill 650? Uh-oh.
You're not against, you just want to help me, don't you?
I do.
Oh, okay, okay.
I'll take all the help I can get.
Thank you, Mr. Chairman, members of the subcommittee, Jennifer Faison, the Virginia Association of Community Services Boards. And I think the comments that I'm about to make will stand for some of the rest of the bills that are very similar, that are going to be before you this evening, and some others that are being under consideration. Thank you for removing the bit that says that the CSB would take custody of the individual. I will say, right now, and again, we are supportive of any attempt that we can do to make sure that people are connected to care. This is really kind of legislating in that gray area of the delayed admission, so it would not impact CSB operations. But when you're tying this process to the current alternative transportation provider, it might be good to check to see if that current provider is willing to take this on as a separate line of business, because this is really sitting with the individual in the emergency department. There's no guarantee that that would be the same person that would do the transport. So it could be the same company, but it's really kind of a different service than the transportation service. And if indeed it is intended to be the same service as alternative transportation, in other words, that person, that individual is going to be the actual provider of this transfer of custody. Right now, the contracted alternative transportation provider does not restrain people. So that restraint is not part of what is included currently in the contract for alternative transportation. And I don't know if it would be worth it for this body to investigate whether there's a comfort level in transferring custody to somebody who at this moment cannot restrain the individual in the emergency department. So again, no harm to what you all have in front of you and what you're contemplating, just a couple of things that might be worth checking on as you move
And let me
forward.
ask Senator Hanger, I mean, wouldn't this of necessity require either a new or a revised contract?
Right, in fact, the language in the enactment clause basically says it shall amend its existing contract.
Yeah, okay.
Or enter into new contracts, so I expect they would have to issue a new RFP.
Right.
To
Right.
cover that.
And I think the hitching it to an alternative transportation provider, if that alternative transportation provider is not going to do both the sitting in the emergency department and the transporting, is where, so maybe if it was just a contract, but again,
A
I'm not
contract.
DBHDS, I'm not speaking on behalf of the department, it was just something that occurred to me as I was looking at this, because currently, the alternative transportation provider does not restrain an individual at all. They're prevented from doing so.
Okay. Any questions? All right, anyone else to speak on Senate Bill 650? Oh, we have someone else. Come ahead.
Mr. Chairman, members of the committee, my name is Angela Harvell. I'm the Deputy Commissioner for Facility Services with DBHDS. We do not have a position on this bill today. However, we do have members from our department here available to answer any technical questions you may have regarding this bill and other transportation bills as well.
Okay, great, thank you for being here. Does anybody have any questions? Nobody? Okay.
Well,
Oh, I'm sorry, Senator Barker.
yeah, what would be helpful, particularly given the presentation just before you came up, is the department in a position so that if we pass this, they would be able to negotiate a contract or to revise the existing one so that you don't have separate people who are sitting with the individual in the emergency department and other people that are doing the transport?
We would certainly use the procurement process to either issue a new RFP to determine who has the resources available to provide these services. As Ms. Faison mentioned earlier, she is correct that the current alternative transportation provider does not currently provide any physical intervention for the patient, just transfer only. And so we would have to explore with them and other potential providers who would be able to support.
All right.
There would also be, a significant increase in the cost to these changes, particularly related to training for the existing company and/or another agency that would provide the service.
Mr. Chair?
Yeah, go ahead.
Is the current contract structured in a way so that you could first negotiate with that contractor rather than going out to an RFP for everybody?
That's information that we can find out for you
Okay,
and
that would
let
be
you
good.
know.
All right, that would be great. Thank you.
Mr. Chairman.
Senator Donovan.
Two things, I'll just say, it says that in the enactment clause, that they can amend their current contract if it works. So that's, and I understand it correctly, that the transportation provider, there's no code language that restrains them from restraining an individual. It's just the contract as it exists.
That's correct.
Got it. Thank you, Mr. Chairman. Thank you.
Thank you.
All right, we have 650 amendment in nature substitute in front of us.
I'll make a motion to recommend reporting.
As amended, second.
Been moved and seconded that we recommend reporting Senate Bill 650, amendment in the nature of substitute. Call the roll.
Senator Barker,
Aye.
Senator Donovan,
Aye.
Senator Suderline,
Aye.
Senator Lewis.
Aye.
Ayes 4, noes 0.
All right, we recommended reporting. Senator Hanger, looks like
All right,
you're in good
and-
shape.
Mr. Chair,
Yeah, I'm sorry, Senator Barker.
Senator Hanger, are you going to take the lead in terms of finding out from the Department of Behavioral Health what their responses are to the questions that we'd asked here? Okay, and keep us apprised, so thank you.
All right. Senator Deeds, you've been sitting here for a long time. Why don't you come on up?
I've got a bill that's really similar to Senator Hanger's bill.
Okay.
It's not 682.
Did you say you wanted one of these to go by, or what do you?
Oh, yeah, well, okay, the one I want to
Yeah.
buy is 370.
What?
Newman's number 2.
He's been sitting here for a long time. Steve just
was
got
here
it.
as long as I was.
Oh, I didn't see him. Okay, I'm sorry.
Well, you can
Yeah,
take that first.
he was here, he was just over, I'm sorry.
Oh, that's okay. I didn't see you, Steve. That means you're at the end, Mark.
Put Mark on there.
Sorry, Steve.
That's all right. We may actually want Cree here for all of these.
All right, go ahead.
Mr. Chairman, I have two. If you don't mind, sir, I'd like to take up the first one being 593.
Yes, sir.
It's related to the exact same issue that you just went through, but it deals with it, I think, in a complementary way. Mr. Chairman, as you guys may know, the transportation services, at least in our area, are only taking about 8% of the cases because they can't restrain. They just aren't doing very much, and hopefully Emmett will help that out. Mr. Chairman, the police academies in our area kind of helped us come up with what is an alternative solution, potentially, and this would mean that we would come up with a third level of our auxiliary police officers that would receive training in weapons, defensive tactics, de-escalation, and working with individuals with disabilities and mental health and substance abuse items. It's only about a 3 to 4 week training, but it would give us a third level of auxiliary police officers that could actually potentially de-escalate in these situations. Mr. Chairman, clearly there potentially could be some funding that would be required, and this bill, in all honesty, if it goes upstairs, it has a budget amendment of $20 million that would actually get these officers out to these locations, and they would actually be able to be with those people with mental illness. This is not the entire answer, but I think it's an important item in the toolbox. The current G4S contract, I think, is helpful. If we can renegotiate it in a way that Emmett has talked about, I think it would be potentially even more helpful. But this gives us a less expensive option with someone with the training that they need, but not a police officer. And I'm going to give you a quick story. In Lynchburg the other night, we actually had 20 officers that were supposed to cover the 50 square miles of Lynchburg. 11 of those officers were actually available to be on the road. After the TDOs and ECOs, there were four officers for the entire 50 square miles to actually do police work. And so this is a desire to hopefully get another level of officers that can help us. There is, Mr. Chairman, coming along behind this, a pilot program where we would actually have a triage center and other things. That's not before you today, but there is another bill that's coming before you that hopefully will get some review. That one will be a pilot project. So that's the bill. Hopefully we can get our academies, police academies, to train to this level, which is what they need. They can de-escalate and provide the service that we need without having a true law enforcement officer that's there. There is, Mr. Chairman, an amendment
Okay.
or two.
Move the amendment.
Second.
Moved and seconded that the amendments be adopted. All in favor, aye.
Aye.
Opposed? Okay, go ahead, Steve.
Mr. Chairman, the amendment basically took out the CSBs from a section of the bill that they didn't want to be included in page 2 and cleaned up the grammar. So that's basically the amendment.
Okay, great. Any questions for Senator Newman? No questions? Anybody here to speak in favor of Senate Bill 593? Anybody speak against 593?
Chairman, would you like a motion?
Yeah, I think we're ready for one.
I'd like to move that our subcommittee recommend report by the full committee.
As amended.
As amended,
Second.
yep. It's been moved and seconded that we recommend to the committee adopt or passing Senate Bill 593 as amended. All in favor, call the roll.
Senator Saslaw,
Pass, because I didn't hear.
Senator Barker,
Aye.
Senator Donovan,
Aye.
Senator Suderline,
Yes.
Senator Lewis.
Aye.
Ayes 4, no 0.
Okey-doke, Senator Newman, you got another one, I
593,
think, right?
Newman.
Mr. Chairman, this one, I think is straightforward. I don't think the administration has any opposition to doing basically what is a Section 1 study. He would ask the Secretary of Health and Human Resources, together with the Secretary of Public Safety, to work on best practices across the country to deal with TDO and ECO issues. It does mention in the lines 30 through 33 those individuals that hopefully we can coordinate with. I think that all these are helpful. The Deeds Commission has done a lot of work. We're layering onto that. Someone's got to look at the big picture. Is there another way to do this that other states are doing it that maybe be completely more helpful? And that is the hope of the Section 1 study.
All right, great. Any questions for Senator Newman on Senate Bill 202?
No, this is 202.
Anybody in the audience to
What we
speak
voted on.
to Senate Bill 202? In favor? Against? Oh, wait, we have a favor? Come on. Yeah, come on, get up here. You can sit there. Just, he'll scoot it over for you.
Yeah.
Mr. Chairman and members of the subcommittee, Jennifer Wicker with the Virginia Hospital and Healthcare Association, and we support the bill.
Hello. Mr. Chairman, members of the subcommittee, I'm Rachel DeGraba from the Office of the Executive Secretary of the Supreme Court. We don't have a position on this bill. We just kindly ask that we be added as stakeholders so our Director of Magistrate Services can weigh in. Oh, it's no problem at all. Thank you so much.
Yeah. Yes, ma'am.
Hi, excuse me. Katie Boyle with the Virginia Association of Counties, here to register our support for the bill. Very interested in encouraging alternative transportation to relieve some burden on law enforcement. Thanks to the patron
Great.
very much for bringing it.
Yes, ma'am. Ms. Faison?
Jennifer Faison, Virginia Association of Community Services Boards, here in support of the bill.
Great. Do you want to amend that to address our issue?
Yes, sir. If council doesn't mind, I did not think of adding them to it, so. yes.
Okay.
I'd like to make that motion,
Yeah.
Mr. Chair.
There is that we
Moved
voted
and
on.
seconded that we make the amendment to add add the magistrates. Is that who it would?
No,
Or the executive
Executive
secretary, yeah.
Right.
All right, it's been moved and seconded. We add the Office of Executive Secretary of the State Supreme Court. All in favor?
Aye.
Opposed? All right, so amended. I guess we need to vote. We haven't voted on it yet.
No.
Give me a motion, somebody. Senator Suderline moves.
To
Senator
recommend-
Barker seconds
Yes.
that we recommend reporting Senate Bill 202 as amended to the full committee. All in favor? Call the roll.
Senator Saslaw. Senator Barker.
Aye.
Senator Dunavant.
Aye.
Senator Suderline.
Yes.
Senator Lewis.
Aye.
Ayes 5, no 0.
Is that all you got? Okay. All right, now Senator Deeds.
Mr. Chair, Senate Bill 373, I've been sensitive about this last resort legislation for several years, and asked an old friend to try to come up with some ways to amend it. I put a 373 out there, hopeful we could build some consensus, but that hadn't occurred yet, so I'd ask you to carry that over, and we'll look at it next year.
Okay.
I'd make that motion, Mr. Chairman.
Second.
Seconded that we carry 373 over to the 2023, or recommend carrying it over to the 2023 session. All in favor, call the roll.
Senator Saslaw. Senator Barker.
Aye.
Senator Dunavant. Senator Suderline.
Yes.
Senator Lewis.
Aye.
Ayes 5, no 0.
All right, she's carried.
Senate Bill 682 is somewhat like what you've heard from Senator Newman and Senator Hanger. It's got a cognate in the House. Delegate Bell and I have been working on this issue together. Here, if a temporary detention order has been issued and a state hospital is receiving facility, an employee of the state hospital or designee of the state hospital can take custody of the individual. The alternative custody provider can provide transportation to the receiving facility once a bed's available. This ensures that the individual subject to the order is in the custody of someone who has training and experience working with individuals with mental health crisis and relieve some pressure off of law enforcement for people who are right now being boarded in emergency rooms.
Okay.
And that's simply what the bill does.
All right, are there any questions of Senator Deeds? Senate Bill 682. No questions from the subcommittee? Is there anybody in the audience to speak to Senate Bill 682? Yes, ma'am. Come forward.
I may have missed it. Was this with amendment or without?
Without.
I'm, Mr. Chairman, members of the committee, I'm Elizabeth Hobbs with the Virginia Sheriff's Association. We are in opposition to this bill. It extends the period of time that law enforcement is on the hook, if you will, for the custody period. It does not solve the problem for law enforcement. It does not necessarily solve the problem for the patient either to get speedier treatment. As it stands, we are opposed.
Okay. Are there any questions? Any questions? I have one. Is there anything we could do to it to take the sting out for you?
Yes, sir. I have looked at the lines on line 86 and 87, striking the language allowing the state facility to articulate that they have no bed, so striking the language, no bed for the person is immediately available at such state facility, and an employee or designee of such state facility is available to take custody. Striking all that. And then striking the language on line 94, beginning at transportation to an alternative facility, striking all of that through line 104. Adding language, transportation and security of the person being admitted shall be the responsibility of the state facility. That does help. That alleviates the burden on law enforcement, does not continue the period of temporary detention in perpetuity.
All right, give me what you did on 87 again, please.
May I hand it to you?
That would be perfect. Thanks. Because you got one, well, you haven't got one for everybody, have you?
I don't.
Okay.
I have one spare.
So did everybody get the amendments? Do you all understand what she's suggesting?
Striking all those lines. What was the line added? The red?
Transportation and security of the person being admitted shall be the responsibility of the state facility.
Have you shared, has Senator Deeds seen this?
He has.
Have you seen it?
Yeah, I've seen it.
What do you think?
Honestly, I think that right now you have TDOs in perpetuity in some situations anyway. And I don't think that my bill does what her concern, I think it does address the problem she's trying to address. I don't mind, you make any amendment you want to, let the bill go forward, and we'll figure it out.
Okay.
We'll figure it out, or we won't.
So you're saying you think her concern is a little misplaced in your bill?
I think it's misplaced.
Okay, well, you all can hash that out,
Unoverblown.
can't you? All right, have you all looked at the amendment, suggested amendment?
George.
You guys want to take a look at that?
Well, we've got it.
Yeah, they've got it passed now.
Yeah, okay, Council.
Mr. Chairman, I have a question. Will they
Senator Suderline.
review? Thank you, Mr. Chairman. My question is for the association. So is this amendment widely agreed by your members?
Our members are in the position of being in support of anything that reduces the burden on law enforcement. Without the amendment, it increases the burden on law enforcement.
Mr. Chairman, I ask because I don't have time to contact all my sheriffs, and several of them expressed concerns about this bill. And what I'd want to know is if this is the consensus position of your membership, or if this is, maybe 2/3 of the membership, but I might happen to represent that third that doesn't like it.
Their attention was drawn to the issues presented by this bill.
Yeah.
And so I suspect if you've heard from them, it's in response.
But I think he's asking you, does this amendment alleviate the concerns that they would have expressed?
It does.
Okay. Then they would Mr. Chairman.
Yep, Senator
They
Donovan.
would therefore be on board.
It is in response to the concern,
Okay.
yes.
And this gives them also time, Senator Deeds and the Sheriff's Association, to figure out whether it actually does what they fear it does. So, and we'll move the bill forward. All right, we've got suggested amendments in front of us.
Move the amendment.
I'll second.
Moved and seconded that we adopt the amendments. All in favor? Aye. Opposed? Okay. All right, so we have the bill in front of us. Anybody else want to speak to Senate Bill, I've forgotten the number now, Senate Bill 682? Anybody in the audience? In support? Against? Okay.
Mr. Chairman, I'd make a motion.
Yes, sir.
I move that the subcommittee recommend report of the bill as amended.
Okay.
Second.
It's been moved and seconded that we recommend reporting to the full committee, reporting Senate Bill 682 as amended. All in favor, call the roll.
Senator Saslaw, Senator Barker,
Aye.
Senator Dunavant,
Aye.
Senator Suderline,
Yes.
Senator Lewis.
Aye.
Ayes 5, noes 0.
Okay, Senate Bill 714 is a very simple Section 1 bill. It's modeled after a law that was adopted in Maryland that was named after the, Congressman Raskin's son who died last year, the Thomas Bloom Raskin Act. It simply directs the Department of Behavioral Health to incorporate a voluntary mental health check-in option into their crisis system. It's a proactive measure that allows someone to voluntarily request periodic calls from trained counselors who work with the crisis line. The past couple years, have been awful tough for a whole lot of people, and our mental health system is strained. This is one option we can provide to help people who are in crisis.
All right, very straightforward bill. Any questions from Senator Deeds on Senate Bill 714?
I'm ready to make a motion.
Well, let's just for performance sake, see if anybody's out there to speak in favor of 714. Here we go. Yes, ma'am, please come up.
I'm Heather Norton with the Department of Behavioral Health and Developmental Services, Assistant Commissioner. I'm overseeing our crisis system transformation, and we are in support
Great.
of the bill.
Okay, thank you. Anyone else to speak in favor? Anyone possibly out there against 714? I didn't think so. All right, now Senator Suderline.
I move that our subcommittee recommend report of Senate Bill 714.
Second.
Been moved and seconded that we recommend to the full committee reporting Senate Bill 714. Call the roll.
Senator Saslaw, Senator Barker,
Aye.
Senator Dunavant,
Aye.
Senator Suderline,
Yes.
Senator Lewis.
Aye.
Ayes 5, noes 0.
Great. Thanks, Senator Deeds. I got next on there. Senator Peak.
Sir.
What you got?
Thank you, Mr. Attention Subcommittee Chair. I think,
Wow, you've got one too.
Mr. Chairman, I think mine is very similar to Hanger's and Newman's, maybe a little bit different than Deeds. I have not had time to review theirs. I suspect mine is a candidate to be rolled in to one of them. I just don't know which one yet.
All right. If that's your position, then I would suspect we just send this on to the full committee without any recommendation and roll it in there.
Yep, roll it in there, pick out, and then I can take a look and see which one it is
Yeah, just let us-
closest with.
Similar to Hangers.
Let us know.
I think
Yeah,
it's similar to
I think
Hangers.
Senator Dunham's right.
Okay.
Yeah. Hangers.
It is, there, you would want to probably make the same line amendments to this bill, Mr. Chair, that we made to.
All right. Well, if we,
Senator Newman's
Was
bill.
it Newman's or Hanger?
Yes,
Yes.
that takes the CSBs out, and then replace Senator Peak's language would be identical to the language that actually appears in Senator Hanger's bill. It also appears in Senator Newman's bill, and it also appears in Senator Fabola's bill that you will hear shortly.
Move the amendments.
yeah, let's go ahead and take care of it here.
Second.
Delegate Bell, Byron has one similar to
On the
this in
House
the
side.
House.
The House doesn't exist.
So we have suggested amendments for Senator Peak's bill to bring it in conformity with the other bills we've heard and will hear. Is there a motion on the amendments?
Move the amendments.
Moved, and Senator Suderline seconds that we adopt the amendments. All in favor, say aye. Aye. Amendments are adopted. So the bill before us is before us as amended, and then we need a motion to roll it in. Would Senator Hanger's bill be the most appropriate vehicle?
It is identical to Senator Hanger's bill, but for the enactment clause that Senator Hanger has.
Okay.
Move to roll it in and make chief co-patron.
Yep.
Second.
All right. So that's the motion. All in favor? Let's call the roll. I think it's a recorded vote.
Senator Saslaw, Senator Barker.
Aye.
Senator Dunavant. Senator Suderline.
Yes.
Senator Lewis.
Aye.
Ayes 5, no 0.
Thank you, Mr. Chairman.
Work, Senator Peake. Next, we have Senator Favola. And what do we have here but a emergency custody and temporary detention?
The same.
Yeah.
So
One
I.
we all agree on.
Yes,
Yeah,
which
exactly.
is probably a good thing. We can find a solution. So my bill, again, directs the magistrate to look at a number of options when an individual is under an emergency custody order for transport. If an alternative transportation contractor is available and the individual would be a good candidate to be transported, then law enforcement can release the person to the alternative transportation provider. And under my bill, the alternative transportation provider actually would retain custody should they get to the hospital or crisis intervention center till an evaluation is done, and until the individual is determined to be under a TDO or released. So my bill does require that the alternative transportation provider stay with the person being transported until there's a determination made about TDO and being or not being eligible for TDO. Having said all that, I have an amendment in the nature of a substitute
Okay.
that eloquently says what I just said.
Okay. All right.
And I had made some tweaks. My bill does not have the enactment clause that Senator Hanger's bill has, directing the state to reevaluate the contract.
Yeah, Senator Donovan.
Mr. Chairman, Senator Favola, and maybe council, does this align it with any of the other bills we
Yeah.
have heard?
Mr. Chair.
Yes.
So, this bill includes all of the pieces that you just saw in Senator Peake's bill and that we've seen in Senator Hanger's bill. So it has overlapping language with Senator Newman's bill, Senator Deeds' bill, Senator Hanger's bill, and Senator Peake's bill. It already includes that line amendment that we've made to a couple of them, so we don't need to make that change. It does, however, include a bit of extra language that Senator Favola has described, sort of shifting the priority to look, right now when you order alternative transportation, when an EC or TDO is entered, the magistrate has to designate the local law enforcement, and then there's a second layer of determine whether alternative transportation is appropriate. This bill sort of shifts that analysis to give alternative transportation more primacy, so that it might be earlier consideration.
So it's an option that must be looked at right away. Is that fair?
Yes, very much.
Substitute.
ECO.
Second.
Moved and seconded that we adopt the amendment in nature of a substitute. All in favor? Aye. Opposed? Okay, the substitute bill, amendment in nature of a substitute is before us. Are there any questions for Senator Favola?
I worked with Ms. Faison with the Community Services Board and the Association of Sheriffs and others, as I expect my colleagues did as well.
Okay. Let me ask for public comment. Is there anybody speaking in favor of Senate Bill 268? Yes, ma'am.
Elizabeth Hobbs with the Virginia Sheriff's Association. We are in support of this bill. It does provide some relief for law enforcement. One of the difficulties when an officer or deputy is sitting in front of the magistrate is that they may not consider alternative transportation if it is even available. And so this amendment does prioritize that. So if it is available, that's what should be used if it's appropriate before we get to the law enforcement. And so it's even a further step. So we're very much in support.
Any questions of Ms. Hobbs? All right. Anybody else to speak in favor of 268? Anybody opposed to 268?
Mr. Chairman, I move to recommend reporting as amended because it does have a different
Right.
component to it.
Right. All right. Is there a second?
Second.
Been moved and seconded that we recommend reporting Senate Bill 268, amendment in the nature of a substitute. Call the roll.
Saslaw. Senator Barker.
Aye.
Senator Dunavant.
Aye.
Senator Suderline.
Yes.
Senator Lewis.
Aye.
Ayes 5, no 0.
Okay.
Thank you so
Thank you,
much.
Senator Favola.
Have a great day.
Okay. Senator Morrissey is not here. Where is he? Oh, there he is. Oh, he's out in the hallway.
Okay.
Okay. So we'll just be at ease for a moment while he...
Got Barker and me.
Oh, I didn't know. I'm sorry. I didn't even realize we had patrons from the... All right, let's take them in the order they fall here. Who comes first? Barker, I think you're first. Senator Barker?
Yeah.
I'd like to ask that this be passed by for the day.
Sure.
We'll take it up next week.
All right, Senator Barker would like SB 340 to go by for the day. All in favor? Aye. Opposed? Okay, bye for the day. All
Mr. Chairman,
right.
ours might take us a few minutes. Mine might take me a few minutes. Do you want me to start or wait for yours?
Let's see.
Try to be as quick as I can.
His looks like his will be pretty quick.
Yeah. He's approaching. Okay.
Is he coming? Yeah, here he comes. Okay. Senator Morrissey. What do you have for us?
I have 641, Mr. Chair, and good afternoon, Mr. Chair and members of the committee. 641, first of all, what I would like to do is move the amendment for line 29, and the amendment inserts clinical on line 29, on line 29.
We've got the amendment here. Okay, great. Yep, moved and seconded that we adopt the amendment to line 29 on Senate Bill 641. All in favor? Aye. Opposed? Okay, the amended bill's in front of us, Senator Morrissey.
I'll be brief. Senate Bill 641 establishes the Early Psychosis Intervention and Specialty Care Program Advisory Board. That's a mouthful. It establishes a board, the Early Psychosis Intervention and Specialty Care Program. I came before you last year. You're familiar with it. It passed Senate Education 14-0 and passed the full Senate 39-0. This board will assist the Department of Behavioral Health and Developmental Services in providing early psychosis, mood disorder detection, and intervention services. The strategies employed by the board will enhance services that are already there. It'll expand programs for early detection of psychosis. It will, and one of the things that we have found out is that early intervention and access to treatment are important in identifying and reducing effects of mental health illness. 1 in 6 children ages 6 to 17 experience mental health illnesses each year, but sadly, only 50% of them receive services. And the average delay from mental health illness symptom onset to treatment is 11 years. So all it is a board that will assist the Department of Health, Behavioral Health and Development Services in providing this early psychosis detention. I'm hoping several people are thinking, well, it sounds good. We passed it last year. What was the hiccup? The hiccup is that after it got through the Senate, went to the House, at that point they had a fiscal impact of $16,000.
Would it passed away in appropriations or finance or somewhere?
Yes.
Okay.
So
I remember the bill.
I can
Yeah.
go a little deeper into it, but I don't, is there, may I ask, Mr. Chairman, is there a Thomas Schuplin here?
I think I got an email from him.
You got an email?
Thanks.
And if, with your permission, Mr. Chair, there's
Yep,
just a
I did.
letter from Mr. Schuplin to the
We all
folks
got
in-
it.
You all got it?
Mhm.
Okay, great.
Yeah, at least the email indicates we all got it. Yeah.
Okay, on January 31, 2020.
Yep, that's
Okay.
it. Uh-huh.
Can I answer any questions?
Yeah, any questions for Senator Morrissey on the bill that we heard extensively last year?
No, sir.
Anybody in the audience want to speak to the bill that we passed out of here without any problem last year? Okay. All right. Finance or appropriations. All right, the bill is in front of us as amended.
Move to report as amended.
Second.
Moved and seconded that we recommend reporting Senate Bill 641 for reporting to the full committee as amended. All in favor, call the roll.
Senator Saslaw, Senator Barker.
Aye.
Senator Dunavant.
Aye.
Senator Suderline.
Yes.
Senator Lewis.
Aye.
Ayes 5, noes 0.
Great.
Okay, thank you for your
Senator
time,
Morrissey.
folks.
I see, we're getting ready to go to Senator Dunavant, but I see, do we have anything from Senator Boysko?
I just spoke with her. She would like us to move on with Senator Donovan's bill.
I come to the end. That's right, I have a note here. I saw that. I'm sorry. All right, Senator Dunavant, you're up.
Thank you. Mr. Chairman, Chairman, may I sit here? Do you want me in the hot seat?
No, you're fine.
Okay. Mr. Chairman, I have before you today Senate Bill 750. And to frame the reference point for this bill, it's one with which this committee is very familiar. And it has to do with the crises we have with inpatient mental health services in Virginia. We are currently occupying our state hospitals at often 102%. They're staffed at 75%. And Mr. Chairman, I'll point out that staffing at 100% anticipates a hospital occupancy of 88%. So our 75% staffing is much more concerning than it even sounds. We have crises that are added to this over time. As we have lost staff, we have also lost our ability to be the bed of last resort, as is mandated in the code. And this summer it was suspended. It is now at a 1-to-1 ratio with discharges. We have long ER holds, which we have heard about in great detail today, because we don't have a bed to which a patient can go. Stress on law enforcement. We have loss of CMS certification for our hospitals with the 50% portion of the reimbursement that they would pay, putting a additional financial burden on the state. And we have the DOJ settlement, which remains unsettled now. And actually, we may have the risk of it being revisited. So, Mr. Chairman and members of the committee, what this bill seeks to do is to find maybe an alternative way for us to solve this problem, because the changes we've been making and the solutions we've offered have led us down a path where we're still in crises. And I would suggest that our current model, where the hospitals are a component of a state agency, is part of the way that we are thwarted in making innovative changes that could help us solve this list of problems. As a state agency, these hospitals are bound to use VITA and IT, and we know we've had problems with IT. Even when I was first elected, and really until maybe about 3 years ago, our mental health hospitals ran on paper 6 of the 9. And so we have the contracting and procurement issues that we have as a state agency, and we have many requirements and constraints that make this entity, which is really a hospital entity, function outside the realm of best practices, efficiencies, and opportunities that we have of every other type of hospital that functions in the state. And so this bill I actually have a substitute for, or actually, Mr. Chairman, I have the beginning of a substitute, because as I've worked through the new administration with this and talked to stakeholders, this bill sought to find a solution that has been modeled in other states, and that is an authority. And an authority has very prescriptive guidelines and codified language. We have examples of authorities here in Virginia, with VCU being a hospital system that adapted to an authority. It's been very effective for them. Some of the innovative things they've been able to open are things like behavioral health homes that would be relevant to what we're talking about. We also have Chesapeake General that we all know is also an authority. But there are other options. I have an article here today that you may remember from Governor Kane that came out in 2008 that talked about adaptations about privatizing our hospitals. The things we know about how we need to go forward in Virginia is that we need to have a seamless, comprehensive ability to move individuals through inpatient to outpatient services as defined by DOJ, but also as defined by best practices, something that we're building. We really need to have maybe a regional perspective when we look on this. There's a way for private-public partnerships to solve the problems and make sure nobody has to stay in an ER, but there's always a bed that they can go to and outpatient services that can support them. So, Mr. Chairman, I might ask you to move this bill forward if the committee agrees in concept and allowing this idea to evolve a little bit, but it will take out all of the prescriptive language about an authority and will simply direct the HHR to come up with a new model that would allow these goals that we have to be achieved in an innovative way that would probably look at uncoupling the hospitals from the agency that thwarts it. And Mr. Chairman, I'm happy to answer questions and get into more detail, but that is my most concise ability to, attempt to give you an overview.
Okay. And is there a finance component to this?
Yes, sir. There is a finance component to this with both language and money.
Okay. And so let me ask, well, there's two people from finance here. What's our deadline to act on bills that have financial implications?
I know, Mr. Chairman.
Did
It's
you look?
Monday.
Is it Monday?
Yes.
That's what I thought.
And
Okay.
so it would have to come out of this committee this
Today.
week and to go to full committee on Thursday.
Yeah.
Yes, sir.
Okay. I was going to say we could pass it by for a week so you could actually have a hard substitute, but I think obviously we have to deal in concepts here in order to move the bill forward. So, all right. Are there any questions for Senator Donovan? Anybody in the audience to speak in favor? Aye. Julie?
May not be as brief as I was the other night, but we'll try. Mr. Chairman, members of the committee, Julie Dime with the Hospital Association. I don't want to repeat what all that Senator Donovan just said. I would just echo her comments. In July of last year, when the state shuttered 250 beds overnight, that had significant impact on the private hospitals, who are now taking 90% of all TDOs and nearly all of voluntary patients. What it was happening and what's occurring now is not working. And so therefore, let's try something new and see if there are other ways that we can look at how the behavioral health system is structured in Virginia. And I do think this might be a good way to start that conversation and to begin figuring out how we actually put some money and resources behind what we need to have done. But taking it out of maybe the agency, maybe that's a good look to see how we function as hospitals and the private hospitals function, and see if we can take best practices from what we're doing, but also other states are doing. I do think this is a great start to a good conversation that needs to be had.
Okay. Anybody else to speak on Senate Bill 7? Or any questions for Julie? Does anybody have any questions for Ms. Dunn? None?
No, I thought she was brief. That was good.
Okay.
Thank you.
Has graded your performance. So.
Thank you. I appreciate that.
Senate Bill 750. Anybody to speak in favor? Ms. Faison? Are you against or in favor?
I am solidly in between. Mr. Chairman, members of the committee, I look forward to seeing the substitute that's presented. I think from the Virginia Association of Community Services Board's perspective, we would be concerned about anything that decouples the experience of hospitalization, which is just one part of the entire continuum of care, to make sure that that doesn't get decoupled from either the prevention services or the downstream services. And so that would be what we'd be concerned about, and look forward to seeing an amendment when that's available, or a substitute when that's available.
Okay. Any questions for Ms. Faison? All right. Thank you. Is there anyone else to speak on the bill, either for or against? All right. So conceptually, what you're looking at making some, obviously, amendment in the nature of substitute level changes to this.
Absolutely, yes.
So what types of things are we looking at so we can know what concepts we're?
The concept would be, and council has some ideas, but, and do you have that to hand out? That's wonderful, Sarah. Okay.
Can you just give us the Reader's Digest version of what the?
I can go ahead and tell you, this would be HHR, Secretary of HHR shall develop and implement a plan to transition responsibility for operation and oversight of state hospitals from DBHDS to another entity. That could be private, public. There's some language that we're putting in there. It could be, but we'll leave that open. To administer such system effectively and efficiently to ensure accountability. There is language in there that talks about the continuum from private sector to inpatient. The Secretary will work to develop appropriate structure, governance powers.
Who's speaking?
And the plan may include provisions for implementation of a regional approach. But, Mr. Chairman, I just had the opportunity to kind of get feedback on this and start this afternoon. But it's going to be about leaving that permissibility possible so that as we come together and look at this as an opportunity to reframe this, obviously the stakeholders will be involved and will be needed, but this is an opportunity to rethink how do we interconnect hospitalization with the brave new world that emphasizes outpatient and community-based services. And our system that we have now is much more focused on regional beds that aren't operating and aren't available. And, if we're going to depend upon the private hospital system to this level, a private-public partnership would be a really healthy way to do that instead of surprising them.
So you've heard conceptually which Senator Dunavant's trying to work on for a substitute for the bill. Are there any questions of her? Okay.
What's our last bill?
One that we got Boys Coast.
Oh, Boys Coast here. Okay.
Senator Barker, you have any observations? Not to put you on the spot.
You just did.
Yeah. I think this is something we can work through to be able to address, get options, and I think it might be worthwhile getting multiple options in terms of how to deal with it. I mean, it's possible that there can be a turnaround in what we have, but also there are other ways in which to structure the system, and I think it needs to be, as Ms. Faison said, it needs to be integrated with everything else. You can't have it stand out as sort of they're doing their job and not really interacting with others. So.
And support the outpatient and community. Yeah.
Okay, so conceptually, we have the idea for an amendment in the nature of a substitute. We have to move the bill along because it has finance implications. So the recommendation would be, or do we have a recommendation? Senator Suderline?
Thanks, Mr. Chairman. I think that it's clear that the conversation is going to continue, and that's what Senator Dunavant plans to do. So I would recommend, and it's also going to need to go through finance. So I would move that our subcommittee recommend report and re-referral to finance.
Recommend reporting to Education Full Committee.
Well, yeah, but it's recommended by the full committee and re-referral to finance.
But I think we need, in the form of an amendment in the nature of a substitute.
Correct.
Because there are going to be changes to what we have in front of us.
Sure.
Second.
All right. It's been moved and seconded that we recommend to the full committee reporting Senate Bill 750 as a conceptual amendment in the nature of a substitute. All right. Let's get a motion. Did you
we
move?
just motion?
Okay. All right. It's been moved and seconded that we do that. All right. Call the roll.
Senator Saslaw,
Aye.
Senator Barker,
Aye.
Senator Dunavant,
Aye.
Senator Suderline,
Yes.
Senator Lewis,
Aye.
ayes 5, no 0.
All right. You got some work to do, Senator Donovan. And I would ask, as soon as you get that, could you get it to the members of the subcommittee?
And further, Mr. Chairman, if any SAGE members of the subcommittee actually have ideas of language that should be in there, I'd be very welcome to that.
He's the sagest.
That's
so
why
you
I'm
can-
looking at him. He's missing me.
All right. Senator Boysko, you're standing between us and cocktail hour.
Oh, thank you. I'm sorry. I had the good senator from Williamsburg's proxy, and he was very busy in another committee, so thank you. So last week, we heard SB 448 around hospital regulations and
That's right,
policies
yes.
and procedures related to victims of domestic violence.
Yes.
I had a huddle with the hospital folks, and I think we have come back with a substitute that everybody will be happy with.
Great.
So I guess I would hope that you would move the substitute.
Yep.
Second.
Moved and seconded that we adopt the amendment in nature of a substitute. All in favor? Aye.
Aye.
Opposed? She's in front of us.
Okay, great. So the substitute directs the task force on services for survivors of sexual assault, and I'm a member of that. It was convened last year to convene a work group within that body to develop best practices for hospital policies and procedures related to victims of domestic violence and sexual assault. And then they would report the findings and recommendations by November of this year. And as I said, I'm a member of the task force. I've spoken with the chair of the task force, Delegate Delaney. The hospital, VHHA, seems to be happy with it, and I would so move that you agree this is a Section 1 bill, and I think would be the perfect place to work out these issues.
All right. I've gotten the high sign from the hospital folks. Anybody else to speak to the bill?
Mr. Chair,
Yep, Senator Barker.
anytime someone converts a 5-page bill to a half-page bill, this is good for me, so.
That's right.
We've got a prize for you, Senator Boy Scott. All right.
To report, as recommend is reporting as amended or
Yep.
substituted.
All right, moved and seconded that we recommend to the full committee reporting Senate Bill 448 as an amendment in the nature of substitute. Call the roll.
Senator Saslaw,
Aye.
Senator Barker,
Aye.
Senator Donovan, Senator Suderline, Senator Lewis.
Aye.
Ayes 5, no 0.
All right,
Go
you're
get your
good.
cocktails.
Yeah.
Unanimous
Thanks, Senator Boy Scott.
Committee meetings.
Yeah, I think that's right.
It was,
We did.
everything was
Yeah,
unanimous.
everything was.
Yeah.
It's kind of scary, isn't it?
It shows exactly.